Let me tell you about a woman named Eleanor. She's 63, lives in a tidy bungalow outside Asheville, North Carolina, and she still does the crossword in pen. She raised 3 kids, taught high school chemistry for 30 years, and can recite the periodic table faster than most of her former students. One ordinary Thursday in October, she walked into her bedroom, stopped at the foot of the bed, and could not remember what she came in for. She stood there. The ceiling fan turned slowly above her, and for a moment, just a moment, a cold little thought slid in. Is this how it starts? She didn't tell anyone. Most people don't. She laughed it off the way we all do, blamed the long week, the poor sleep, the fact that she's not as young as she used to be. But here's what Eleanor didn't know. The small pill she took every night for her sleep, the one her doctor had prescribed years ago and renewed on autopilot ever since, has a documented effect on exactly the kind of memory she'd just lost hold of. And almost nobody connects the two.
I'm a neurologist. I've spent most of my career sitting across from people exactly like Eleanor. And I want to tell you something that rarely gets said out loud in a rushed 15-minute appointment. Some of the most common medications sitting in your cabinet right now, the ones millions of people over 50 take without a second thought, carry a well-documented cognitive cost. Not a rare side effect buried in fine print. A real measurable effect on memory and clarity. And the tragedy is that the people taking them, and very often the people prescribing them, never link the fog to the pill. This channel exists for one reason: to help adults over 50 understand what the research actually says, in plain human language, without the fear-mongering and without the jargon. So let me be very precise here. I'm not telling you to stop your medication tonight.
I'm not telling you these drugs are useless. For some people, they're genuinely essential. What I'm telling you is that there's a difference between a pill that treats one problem and a pill that quietly trades it for another. And after 50, almost nobody is doing that math with you in the room. Today, I'm going to walk you through 3 of them. 3 everyday medications a neurologist watches with real concern. And I'll tell you now, number 2 is sitting in more medicine cabinets than any other drug on this list. You almost certainly know someone who takes it. You might take it yourself. But before we get to the list, I need to give you one idea. One mental model that makes everything else click into place. Because once you understand it, you'll never look at your nightly routine the same way. It's called the anticholinergic burden.
Let me translate that. Your brain runs on chemical messengers. One of the most important is called acetylcholine. Think of it as the spark that powers memory, learning, and focus. It's the chemical that lets you walk into a room and remember why. Now, a whole category of common drugs works in part by blocking acetylcholine. They're called anticholinergics, and most people taking them have no idea that's what they're doing. The drug was prescribed for sleep or allergies or an overactive bladder. And quietly, as a side effect, it's dimming the very spark your memory depends on. Here's why this matters so much after 50, and I want you to hold on to 3 things. First, your aging brain already makes less acetylcholine than it did at 30. The reserve is thinner. So blocking what's left hits harder. Second, your body clears these drugs more slowly as you age.
Your liver and kidneys take longer to sweep the medication out, so it lingers, and the effect deepens. We call that reduced clearance. And third, this is the one that keeps me up at night, it's cumulative. A single dose of a single drug might do almost nothing, but a sleep aid, plus an allergy pill, plus a bladder medication, taken every single day for 8, 10, 12 years, that burden stacks, year after year, quietly, and nobody's keeping the running total.
Let me say that again, because it's the whole point. The danger is rarely one pill on one night. The danger is the accumulation, the slow, invisible stacking of a harmless daily habit, the anticholinergic burden. Now, the first one. The first is a class of medications most people take for something that feels almost too minor to mention: allergies and sleep. I'm talking about the older antihistamines, the kind in the familiar pink nighttime pills, the ones marketed for hay fever and for PM formulas that help you drift off. Sounds harmless. Sounds routine. It's sold right there on the shelf,
no prescription needed, which is exactly why people assume it must be safe.
This was Eleanor's pill, the one she took every night for the better part of a decade to help her sleep. And when she finally mentioned the bedroom episode to me, almost as an afterthought, at the end of a visit about something else entirely, I asked her one question. "What do you take to sleep?" When she told me, I asked how long. 8 years, she said, every night. Here's the truth most doctors won't say out loud. These first-generation antihistamines are among the most strongly anticholinergic drugs available, and they cross into the brain easily. A landmark study published in JAMA Internal Medicine followed thousands of older adults over years and found that higher cumulative use of strong anticholinergic drugs was associated with a significantly increased risk of dementia. Let me be precise about what that means and what it doesn't. It does not mean one pill gives you dementia. It means the long-term accumulated burden tracked with measurably worse outcomes. The dose and the duration mattered. For Eleanor, the good news was real. We found her a different approach to her sleep, and within a few months, the fog she'd quietly been living with lifted enough that she noticed it. That's the word that matters here. Often this is reversible. So what do you do instead? You don't stop tonight. You ask your doctor whether a newer, non-drowsy antihistamine, the ones that largely stay out of the brain, would work for your allergies. And for sleep, you ask whether there's a path that doesn't run through your acetylcholine at all. There almost always is. Before I go on, I'm genuinely curious where you're watching from tonight. Type your town in the comments. I read them, and it always amazes me how far this reaches. Now the second one, and this is the big one. The second is a category of medications taken for acid reflux and heartburn, some of the most prescribed drugs in the entire country. Tens of millions of people take them. They're in more medicine cabinets than anything else on this list, and they feel utterly benign because heartburn is annoying. The pill makes it stop, and that seems like the end of the story. I'm going to tell you this one differently. I'm not going to give you a single patient's name. No story, no anecdote. And I want you to notice that because I'm doing it on purpose. The data here is significant enough that it doesn't need a story to carry it. And I don't want a single dramatic tale to make you think this is about one unlucky person. It isn't. It's about a pattern across enormous populations. Here's where it gets counterintuitive. The concern with long-term acid-suppressing drugs isn't primarily about blocking acetylcholine. It's about what they quietly starve your brain of over years. By powerfully suppressing stomach acid, these medications can impair the absorption of vitamin B12. And B12 is essential for healthy nerves and clear thinking. A deficiency that builds slowly, over years of daily use, can produce confusion, memory problems, and a fog that looks exactly like early cognitive decline. Several large observational studies have raised associations between long-term use and cognitive concerns. And while researchers still debate the strength of the link, the B12 mechanism is well established and easy to check. And that's the counterintuitive part. The fix can be as simple as a blood test. Most people on these drugs for years have never once had their B12 checked. So here's what to do instead. If you've been on an acid reducer for more than a year, ask your doctor 2 things: whether you still need it at full strength, and whether your B12 level has ever been measured. Many people are kept on these long past the point of need simply because no one revisited the prescription. This is prescribing on autopilot, and you are allowed to interrupt it. If you're still with me, type the number 2 in the comments. It tells me which of these surprised you most, and it helps other people find this. Now, the third. The third is a group of medications prescribed for an overactive bladder. The urgency, the constant trips to the bathroom that quietly shrink a person's life. These drugs work, and I want to honor that, because the condition they treat is real and genuinely miserable. But many of the older ones in this class are powerfully anticholinergic. Remember our spark? These drugs dim it directly. Let me tell you about a man named Frank, 71, a retired postal carrier in Toledo, Ohio. Frank's daughter brought him to me because she was frightened. Over about a year, her sharp, joke-cracking father had grown distant and confused. She used the word that families always use, the one they're terrified to say. She thought he was slipping. She had already started reading about memory care facilities. I looked at Frank's medication list. He'd been started on an older bladder drug, strongly anticholinergic, about 14 months earlier. The timeline matched almost exactly. Now I want to be careful here, because I'm not telling you every case is this clean, and I'm not telling you to leap to conclusions. But in Frank's case, in coordination with his other doctors, we transitioned him toward a newer bladder medication designed to stay out of the brain. Over the following months, his daughter got her father back. Not all the way, not instantly, but enough that the conversation about memory care quietly stopped. That's the trade-off no one had explained to Frank. He'd been handed a choice between his bladder and his mind, and nobody told him it was a choice at all. So what do you do instead? You ask whether a newer bladder medication or a non-drug approach might spare your brain.
The options exist. They're just not always offered, because the older drug is familiar and cheap and easy to renew. Now I want to hand you something you can actually use, because the point of all this was never to frighten you. It was to put the power back where it belongs, which is with you, in that exam room. Here are 5 questions to take to your next appointment. Ask them about any pill you take every day.
1. Do I still need this medication, or am I taking it out of habit? You'd be stunned how often the honest answer is the latter. 2. Is this drug anticholinergic? Does it affect acetylcholine or cross into the brain? Just asking signals you know what to watch for. 3. Is there a newer version of this that's gentler on memory and clarity? For nearly every drug we discussed today, the answer is yes. 4. What's my total burden? When you look at everything I take together, does it add up to a cognitive risk? This is the question almost no one asks, and it's the most important one. And 5. If we stop this, what's the plan? And is this effect reversible? Because so often, it is. 5 questions. Write them down. Bring them in. They change the entire conversation, because they shift you from a passive recipient into an active partner. And any good doctor will welcome them. Let me leave you with this. There's a difference between treating a symptom and protecting the mind that makes you who you are. Your memory isn't a luxury. It's the thread that holds your stories, your people. The morning your daughter was born, the name of the song you danced to. It's not a side issue to be traded away quietly for a better night's sleep or an easier afternoon. You have every right to ask, to understand what you're taking and why, to choose, with clear eyes, between the symptom and the spark. Nobody, no schedule, no rushed appointment, no autopilot, gets to make that trade for you without your knowing. So check your cabinet, ask your questions. Protect the clarity that lets you stay fully, sharply, yourself in the years that matter most. If this helped you see your own routine a little differently, subscribe. This is exactly the kind of thing we dig into here. The things your doctor wishes they had time to tell you. And before you go, I'd love to hear from you. Has a medication ever quietly changed how you felt, in a way no one warned you about? Tell me below. Someone reading needs to hear your story tonight.